died because of COVID. We're close to 500 residents just in Columbus that have passed. That's not even including our neighbors in the suburbs. And while that's a big number, it can grow exponentially. It can go a lot higher very fast. While we are all interested in the graphs and the statistics that tell the story, at the end of the day, this is personal. The virus is raging among our friends, our families, our schools, our churches, our neighborhoods. If you don't know someone who is infected, you will soon. We must stay home. Friends with pre-existing conditions call me. They say they're afraid to run errands. This is about my family and it's about your family. I'm worried who will hear is sick next, who has to go to the hospital and be hooked up to oxygen or a ventilator. This is not political. It's not something affecting others. It is in our families. We must stay home. This can be slowed and lives can be saved, but we need to step up and just stay home. Let's be clear. We all know this. It sucks. 2020 sucks, but it's our reality. Thanksgiving is my favorite holiday. And I have to be honest, earlier this year, I was feeling kind of hopeful that I'd be able to pull off a little dinner that resembled normal years. I bought these, I think, cool Thanksgiving napkin rings. I'm packing them up now. This year's celebrations have to be different. Columbus, this is not a drill. We need to chill out and look out for one another. We need to stop the spread now, or the hospitals will not be able to handle the flood of patients. As the mayor and as the governor said, we are close to the end of this thing. Vaccines are coming, but we've all sacrificed too much to lose the game in the fourth quarter. And let's be clear what the game is. Our grandmothers, our uncles with pre-existing conditions, our healthcare workers who have been sacrificing so much for so long. That's the game. City Council will work with Dr. Roberts and the Health Department and the administration to consider more actions beyond what is announced today if we deem it is necessary to keep our families safe. So please stay home, Columbus. With that, I'll turn things over to my friend, Franklin County Commission President, John O'Grady.
Council President, thank you. Mayor Ginther, County Commissioners Brown and Boyce. Appreciate everybody being here today. I'm John O'Grady, Franklin County Commissioner. And in this Thanksgiving season, I'd like to start with a few positive things first. We're very fortunate to have strong leadership like this in our community to be able to address these issues. We're fortunate to have great hospital systems here in Central Ohio, and certainly we're very fortunate to have some of the resources that we can devote to fighting this pandemic and supporting our residents. With all that being said, we're also in the fight of our lives. More Ohioans have died of COVID-19 than died in the Korean and Vietnam wars put together. But too many of us still aren't taking this pandemic seriously enough. And frankly, I think some of the messaging that you've been getting from our leaders has been a little bit confusing, to say the least, which is why it's so important for us to be here today speaking with one voice about how serious this is and what has to be done about it. Here in Franklin County, we continue to lead the state in COVID cases. More than 43,000 cases to date. More than 650 of our residents here in Franklin County have died. The number of new cases is now more than twice what it was a month ago. Most cases continue to be in the 18 to 40-year-old demographic, which is particularly distressing to me since I have children, nieces and nephews, many nieces and nephews in that age range. Statewide, we had 1,033 new cases on September 16th. 2,140 new cases on October 16th, and then on November 16th, 7,268 new cases. That means that not only are the numbers going up, but they're going up at a faster and faster rate. If that trend continues, we'll have more than 17,000 new cases on December 16th. and that's obviously not sustainable. So make no mistake, we are under attack by this pandemic and this virus, but we're not helpless. When we've been attacked in the past, Americans have always come together to meet the challenge, and it's time for us to do that again. The science is clear that there are things that we can do to slow the spread. We did it very successfully in the spring, and we need to now do it again. Wear your mask, wash your hands, and avoid gatherings. Yes, this means Thanksgiving too. I'm from a very, very large family. Thanksgiving for my family, just like yours, is a traditional thing. It is very, very important to all of us. But we have to sacrifice one Thanksgiving to be able to get to the next. Stay home. Unless you need to go out for work, for school, or for other essential needs, stay home. In recent days, Governor DeWine has strengthened his public health orders, his mask mandate, and he's just yesterday issued a curfew. He's done this not only to save lives, but to save livelihoods. If we can't get this thing under control, it will mean more widespread shutdowns in the future. Our actions today are complementary to the governor's order. Not only can we help to protect our neighbors, but we can also protect the small businesses that make our neighborhoods unique and provide the services and jobs that all of us need. We're asking you to not only stay in after 10, but also to stay home whenever you possibly can. It literally may be a matter of life and death. Thank you again, everyone. Visit our county website, Spread Love, Not COVID, for more information. Thank you.
Next, I'd invite Columbus Public Health Commissioner, Dr. Mysheika Roberts, to share some information. Dr. Roberts?
Thank you, Mayor, and thank you all. Columbus and Franklin County are experiencing a rapid increase in COVID-19 cases. You've heard some of the statistics, but let me share a few more. On October 1, here in Franklin County, we reported 143 COVID cases. That was our 7-day average on October 1. Fast forward to November 15th, and our 7-day average has jumped to 742 cases. The number of hospitalizations in our region, as well as right here in our county, is at an all-time high of individuals with COVID-19. We've never experienced this many patients with COVID-19 in our hospitals since the pandemic started. And our community positivity rate has continued to increase. As of September 20th, or the week of September 20th, our community positivity rate was 3.7. If we fast forward to our last week's positivity rate, it had jumped to 12.5%. As you've heard, and I want to reiterate, we are at a critical point in our fight against COVID-19. We must act now to reduce the number of cases and impact our hospital systems. While it is more important than ever to follow the state guidance, including the governor's new curfew announced yesterday, we must do more now to slow the spread of COVID-19 here in Franklin County. That is why, beginning Friday, November 20th at 6 p.m., Columbus Public Health and Franklin County Public Health are advising all residents of Columbus and Franklin County to stay at home due to the rapid increase in COVID-19 cases and hospitalizations in our city and county. Residents are advised to only leave home to go to work or school or for essential needs, such as seeking medical care, going to the grocery store or pharmacy, and picking up food. We are also strongly advising all residents not to have any guests in their homes unless they are essential workers, including the Thanksgiving holiday, as well as to avoid travel in and out of the state. This advisory will remain in place for 2 consecutive incubation periods, or 28 days, unless we determine a change in this guidance is needed sooner than that. This stay-at-home advisory complements all the state orders that are currently in place, including the new curfew. It does not replace them. Additionally, we urge residents to limit meetings and social events to 10 individuals or less, whether indoors or outdoors, at homes, event venues, or other similar spaces. While weddings and funerals are exempt from the current state orders, this advisory strongly discourages those gatherings as well. All higher education institutions, our local school districts, and daycares are advised to maintain their current learning modalities, but we strongly advise all extracurricular activities to be discontinued immediately. Furthermore, we advise all residents who can work from home or do so to the maximum extent possible, and for businesses to transition as many transactions as possible and functions to online. We understand that these are very difficult times. You've heard others say 2020 has been a challenging year, but we're asking you to step up and do the right thing now to help slow the spread of COVID-19 here in our community. What happens over the next few weeks is very critical. We need your help, and we need your help now. These actions will help us flatten the curve and get our cases back under control. So I'm asking all of you to join me, to join us in staying home and saving lives. Commissioner Mazzola?
Thank you, Dr. Roberts. It's great to be with you, and thank you to our elected officials for convening and partnering with us on this advisory. We certainly appreciate the ongoing collaboration between the city and the county. As was mentioned, right now we are facing a very difficult scenario for our community. The exponential growth of the cases that we're seeing is jeopardizing our ability for our employers and our schools and our hospitals to operate. Our local business community, our nonprofits, they're being severely impacted, and we simply just cannot look the other way, and we have to take action now. So Dr. Roberts talked about some of the specifics in the advisory, but I do want to just build on a few of Dr. Roberts' remarks. We're asking all of our residents to stay home as much as possible. We're asking them to avoid any unnecessary contact with those outside of their household, work from home as much as possible, and do things like curbside pickup for essentials, takeout instead of going inside of a restaurant, support our businesses by buying online. And for those who are able, keep your nonprofit memberships during this time because they too will need our support during the next couple of weeks as we're not able to go there in person. And of course, as was mentioned, if you do need to leave your home, wear a mask, watch your distance, and wash your hands. We're asking our residents to take these steps for those that we're trying to protect, as was mentioned, our family, our friends, our neighbors, the frontline and critical infrastructure workers who are so essential to keep our community moving forward. Our public health departments are working tirelessly to keep up with the rising cases in terms of contact tracing, but it has become increasingly difficult. So we're asking our residents to help us by doing their own contact tracing if they can. Talk to those who they may have been in contact with if you are positive, and if you think that you've been exposed to the virus, self-quarantine right away. We're going to be posting more information about that on our website so that individuals can take proactive measures if they are positive or if they believe that they may have come into contact with someone who is. I also want to close by saying that this is not permanent. This is not something that will be with us forever. We talked about that the vaccine is coming. It will be here soon. But we need more time to slow the spread of this virus in our community. The conditions in our community right now, I would characterize is a fragile state. We need to make sure that we continue to do everything we can. So we're asking everyone to sacrifice a little bit now for our neighbors, for our family members, and quite frankly, for those that you'll never meet, so that we can continue to get back to normal once we do have the vaccine here in our community. As was mentioned, as we all know, Thanksgiving is next week, and the holidays will be here soon, and it's a time for gratitude and appreciation. So during the next month, let's go about our lives with the most cautious of fashions to express that gratitude and appreciation. Let's sacrifice a little now for this season so that our future seasons can be even better. And so with that, it's my pleasure to turn the call over to County Commissioner Kevin Boyce. Commissioner?
Thank you, Commissioner Mazzola. Can you hear me okay? Great,
Yeah.
thank you. Thank you, Commissioner Mazzola, Dr. Roberts, my colleagues, Commissioner O'Grady and Commissioner Brown. I see President Harden and certainly Mayor Ginther. I'm Kevin Boyce, County Commissioner, and I'm probably in day 3 of my post-quarantine, quote, post-COVID-19 positive designation. And I want to just tell you about my experience a little bit. You know, I pride myself on washing my hands and using hand sanitizer every day. I kept myself socially distanced and had a mask on everywhere I went. Yet I started to feel like in typical change of season, my allergies was kicking in. And I felt confident that I had not been exposed and that I had not done anything that would compromise my health or someone else's health. But the symptoms grew much worse every day. My fever shot up. I was carrying over 102 fever that I could not break for several days. And then I started to have a lot of trouble breathing. Now, for those who don't know me outside of politics, you should know that I've probably run no less than 15 marathons in the last few years. I pride myself on taking care of myself and keeping myself together every day. While I don't think I'm the picture of health, I think I work pretty hard at it and do pretty okay with it. My temperature started to go up over a couple of days, and before I know it, I found myself in a hospital bed in a hospital here in Columbus. I was alone. I was scared, and I could not breathe. And I will tell you, I thought every day, what did I do to expose myself to COVID-19? What did I do? Where did I slip up? And my doctor told me it could have been anything. Just being out and about, you subject yourself, you can touch a doorknob and then rub your eye. You can, get a droplet in 1 minute of removing your mask, or, there are all kinds of ways, even that a diligent person could be exposed. And the reason why I wanted to come on and share this with you is because I wasn't sure if I was going to make it. And I can tell you, I feel like I'm in pretty good shape. And so for those of you who don't think that this is real or think that this is serious, I got news for you. And I will tell you, I'm very grateful for the calls and there's so many people who checked on me every day, but it's terrifying. And, when you're in a hospital, you're isolated because they don't want to expose anyone else to it. At one point, when I first was admitted, the doctor wouldn't even come in to the room. The doctor wouldn't even come in because he said, you're highly contagious and you have it. He said, so we're going to test you real quick for rapid test, just because there was a thought that maybe you had the other type of pneumonia and that could be treated with antibiotics or whatnot. And so they just wanted to be sure. But the point being is that, a little effort and a little bit of stress can protect you from a lot of stress and a lot of other type of effort. And so I just want to speak to Central Ohioans and say, let's work together to protect each other. I went through my contact tracing and I was absolutely even more terrified at the people that I could have infected and that I could have impacted their lives. I don't want to talk about others' health conditions, but I called my friend Commissioner O'Grady because we had spent time during those last few election days together. And I know he's had some challenges over the years. And I said, he's got to be one of the first people I call. And it was a tough call that I had to make to my friend and colleague. but he appreciated and immediately called his doctor. And the point is that I think about it, and perhaps I should have never even gone out and campaigned on those last few days before the election. And so, again, I just want to say to those folks who, if you got loved ones and people you care about and that care about you, then you'll mask up, then you'll stay home, and you'll work to protect all of us, because I'd like to see you on the other side of this. I'd like to see Central Ohio be stronger and better in 2021 on the other side of this. I'm healing now, and I probably lost, I don't know, 10 or 12 pounds. And I've been at home, and I'm by myself, but I know I'm keeping others safe, keeping myself safe. And I know we all want to be around people for the holiday, but I want to just warn you and encourage you. If you really love your loved ones around the holiday, then you'll stay at home. Thank you.
Commissioner, thank you for the courage and willingness to share your story, powerful story, a real life example of the seriousness of this disease, even amongst our healthiest neighbors, the seriousness of this virus and this disease. Thank you, Commissioner, for sharing that. Thanks again to Council President Hardin, Commission President O'Grady, Dr. Roberts, Joe Mazzola, Commissioner Marilyn Brown, who's joined us, and her strong support. We are all in full support of this advisory. Other cities and counties across the state are putting together similar advisories and even orders. We're committed to giving our communities throughout the state the opportunity to change the track we're on. What does advisory mean? Well, we think of it like a weather advisory that is issued in the winter months when there is a storm. The winter weather advisory informs you that winter weather conditions are expected to cause significant inconveniences that may be hazardous and potentially a risk to your health and safety. That is where we are now. We are in the storm. These are significant inconveniences that may be hazardous. The storm won't last forever, but what we do in the days and weeks to come will determine how long this storm of COVID-19 will last in Columbus and Franklin County. Our collective adherence to this guidance can literally save lives. We can do this. We've done it before, and we know we have the resolve, the resources, and resilience to do it again. It's not the time to panic. It's time to lead. We are the largest community in the state. And by looking out for one another and following this advisory, we can lead the state out of some of our darkest days. We are very fortunate to have the chief medical officers and leaders from each of the health systems with us. Dr. Joe Gustato from Ohio Health, Dr. Nick Kriasoulis from Mount Carmel Health, Dr. Rustin Morse from Nationwide Children's Hospital, Dr. Andy Thomas from OSU Wexner Medical Center. I know that both commissioners touched a little bit on the capacity of our health systems, but I was wondering if I could ask Dr. Thomas, I think it's so important to reinforce where our health systems are and the potential risk to our neighbors if we do not flatten this curve and slow this spread at this time. Dr. Thomas, would you mind just sharing a few comments from the health system's perspective on capacity and challenges and the dire situation we're in?
Thank you, Mayor Ginther. Can you hear me okay? Great. I apologize, there's some construction going on in my office today, so there might be a little bit of background noise. But I think your points are well made, and I appreciate your office and the County Commissioner's office having this event today, making this announcement. Here in Franklin County, in our 3 adult health systems, over the past 14 days, we've seen an 82% increase in the number of COVID patients that are in our hospitals. That's just over the past 2 weeks. And we know well that people do not tend to be admitted to the hospital on the first day that they get symptoms. It tends to be 7 to 14 days after symptoms or after diagnosis. So until we see a decline in cases per day that really lasts for 7 to 10 to 14 days, we know that our hospitalizations are going to continue to rise. Plus, it's also incredibly important to remember that in Franklin County, we serve, from a referral perspective, 36 counties in Central Ohio, Southern Ohio, and Southeastern Ohio, that hospitals and communities that are relying on us here to make sure that we have the capacity in place to manage the patients that are too sick to stay in those community or regional hospitals. They're doing their part. They're keeping as many patients locally as possible, but it's important for you to realize that for Zone 2, like I said, 36 counties across 40 plus hospitals and health systems, it was just on Monday, November 2nd, that we surpassed 400 patients in the hospital in the zone. To think back in the spring, we peaked at 356. So we crossed 400 on November 2nd. That was a Monday. On Friday, November 6th, we surpassed 500 patients in the hospital just 4 days later. On Tuesday, November 10th, just 4 days after that, we surpassed 600 patients in the hospital. Yesterday, we surpassed 700 patients in the hospital just 7 days after passing 600. And today, we surpassed 800 patients in Zone 2 hospitals across the state, while just surpassing 700 yesterday. So it is a major public health crisis that's now affecting those people even that don't have COVID, because what you're going to see in the coming days to weeks is hospitals not being able to manage the capacity, and they're going to have to stop doing and postponing non-urgent elective cases, surgeries, and procedures in order to free up both bed capacity and staff to manage the rise in COVID positive patients that we're seeing in our hospitals. And this is not just in Columbus, this is across 36 counties of the state. And I'll tell you, Zone 1 in Northern Ohio and Zone 3 in Southern Ohio are as bad, if not worse, than what we're seeing here in Zone 2. So we cannot sound the alarm bell loud enough. People need to change their behaviors. People need to, all the things that you're, Mr. Mayor, Mayor Ginter, that you are recommending are the exact same things that the health leaders have been talking about now for weeks that people need to focus on. So thank you for the chance to comment. I on behalf of all my colleagues and frankly, all the frontline healthcare workers, tens of thousands in our community that are putting their life on the line every day coming in to care for members of our community. Thank you. And thank you for our ability to participate today.
Thank you, Dr. Thomas. I just thought it was really important for the public and for the press to have that information about reaching our capacity and all the other health needs of our community potentially being put at risk if we don't follow the advisory that Commissioners Mazzola and Roberts will be issuing. Now we'll take some questions from the press. We're going to use the raised hand function. You should see a hand icon in the bottom right corner of your screen. Click on the hand and you'll see a hand next to your name in the attendee list. That's how we know you have raised your hand. We'll unmute you to ask your question. Please tell us your name, what media outlet you're with. After your question has been addressed, please click the hand next to your name to turn off the function. If you have any additional questions or follow-up, please click it again. With that, we'll take your questions. Please just tell us your name and media outlet. And I believe our first question is from Tom Bosco.
Hey, Mayor, Tom Bosco from ABC6 here in Columbus. So explain again this advisory. Is this something that can be enforced? And if it's not something that can be enforced, how do you expect people to follow it?
You know, I'll let Dr. Roberts talk a little bit about that, Tom, but we're calling on people to take personal responsibility and to hold ourselves accountable. We're not asking police to enforce proactively, and there's no financial penalty, but there are consequences. If people don't follow these recommendations, more people will be infected, more people will be hospitalized, and more people will die. There are serious consequences associated with not following this advisory. Commissioners Mazzola or Roberts, any additional comments?
Thank you, Mayor. I would just add, you're right, this is an advisory, and we're hoping that the public has heard us, heard our hospital partners talk about the dire situation our community is in right now, and they'll step up, they'll take action, they'll do something now so that we can control the spread of this virus in our community. I think we here in Franklin County have shown that we ask individuals to step up. We ask people to voluntarily make these adjustments. And if we don't see the improvement that we need to see in our cases and our community, we then take another step. So although this is an advisory, and as you said, it is not enforceable, I feel strongly that, at least from the public health perspective, we are willing, if need be, to take further actions that would be enforceable.
Commissioner Mazzola, any additional comments?
Just said, I think, it's certainly our role here in public health to advise our residents and to inform them and provide that guidance. We think that this advisory does that. We're hopeful and confident that our residents will certainly take this advisory and apply it to their everyday life. We think that it includes enough specific information and recommendations to how to best do that. But certainly, as Dr. Roberts alluded to, should the circumstances continue to move in the wrong direction, we will look at other options to help slow the spread of the virus in our community. Thank you.
Thank you, Commissioner Mazzola. Our next question, I believe, is from Carrie Gose.
Hey, Carrie Gose from Columbus Business First. Wanted to ask about dine-in in restaurants. Obviously, you are not putting an order, it sounds like, that to close dine-in, but it sounds like that is the practical effect if people follow this advisory. Can you just talk about the effect on businesses from this advisory, what you expect to see out in the community?
Want to invite an opportunity for any the county commissioners or health commissioners would like to respond?
So Carrie, I'll take a shot at that one. So when the governor put on the curfew yesterday, that in effect, that I should characterize it that way. What we're saying to folks is, you need to be safe. You need to make sure your family's safe. You need to make sure that you're not doing things that are spreading the virus. Restaurants and bars are already hurting. This advisory is a suggestion to folks as a way to help the community, help their neighbors, help their families to stay safe. And certainly, as a former restaurant owner, I understand the pain and the difficulty that restaurants and bars have been through this year. No question about it. I've spoken to them throughout the course of the year on this issue over and over again. This advisory is certainly not anything that's going to be helpful, but at the same time, we need to be cognizant of the rest of the residents of our community, and certainly takeout has been a big part of this year's lexicon. Folks restaurants have adjusted, and they have been surviving in large part due to their takeout and carry out business, and that will continue, I'm sure. It always will. And but at the same time, folks need to understand that when numbers go from 1,000 in September to more than 2,000 in October to 7,200 in November, that is a very, very troubling trend. And we're headed in in a direction that this community can't sustain. And these healthcare systems certainly can't sustain. I think you heard Dr. Thomas talk about where we're headed if these numbers continue to go where they go or where they're headed. And so something needs to be done. And we came here today to make announcements to back up the governor and the announcements that he's made this week. You're going to find in the next day or two that the metropolitan counties all over the state are going to be making similar announcements. And, you know, we just need to make sure that folks are hearing us loud and clear, that the messaging is a united message, and that folks are understanding, especially as we head into the holidays, that gathering together and that doing things that just aren't necessary are what's putting us in this situation. And folks need to think before they act. They need to wear a mask whenever they leave the house. They need to wash their hands on a regular basis. You know, these are things that need to happen. And you know, so we need to make sure that the messaging is getting out.
Thank you, President O'Grady. Commissioners Boyce, Brown, or President Harden, any comments from you all in
I
response
do
to Carrie's
have a
question?
comment. In addition to what Commissioner O'Grady mentioned about ordering food for takeout, I would suggest you also consider the servers that are preparing that food and tip as though you're eating in, because that's incredibly important during this time. It's not something that we're used to doing when you take out, but during this time especially, it's really important to make sure you tip the restaurants so that the servers can get something that they're not getting now because we're not eating in. And it's really an important part of their living, and they're really hurting right now. So I would add that.
Thank you, Commissioner Brown. Any additional comments from electeds? I know we have another question from, looks like Pete Greavy.
Yeah, I just want to follow up about indoor dining staying open here, because it does seem like you guys are discouraging some actions that maybe the public health community would say can be done fairly safely, like extracurricular activities with masks on, or offices having workers in their facilities with masks on. That is now discouraged, but at the same time, indoor dining is allowed to stay open, which we know is creates environments where the virus can spread because people take their masks off indoors, perhaps in a bar or a restaurant without ventilation. So I'm just wondering if you can talk more about why we didn't get a decision today to close indoor dining, and if that is still on the table in the coming weeks.
Well, I'll turn to our public health experts in Joe Mazzola and Mysheika Roberts for their perspective on that. But I think clearly what we've said today and what we've done before as a community is to offer advice and encouragement, whether it was in dealing with masks earlier on, bars and restaurants, and then take an action if that advice and counsel is not taken and heeded. So certainly we will contemplate additional actions in the future if we are not successful in slowing the spread and flattening this curve a bit. This exponential growth is a clear and present danger to the threat, health and safety here in Central Ohio. But Commissioners Roberts or Mazzola?
Thank you, Mayor. I'll take a stab at that question. Clearly, the advisory is encouraging all residents in Franklin County to limit their activities to just the essential functions. So yes, you can interpret that to mean that we're asking people if they need food to go to the grocery store or to do pickup or delivery. We're also asking businesses, when possible, to allow their employees to work remotely when possible. Not every business is able to do that. But those who can, we're asking that they do that now. And we're also encouraging businesses, including restaurants, to think of new creative ways to move as much of their business online or remote as possible, which would include takeout and pickup for those restaurants. We have known there's been studies out there that have shown that indoor dining is a risk. And as we go into the winter months and we know there are less opportunities for outdoor dining, particularly here in Ohio, indoor dining can be a risk. And it has nothing to do with the restaurant itself. It has to do with the function that people are doing in those restaurants. You have to take your mask off to eat and drink. From the inspections Columbus Public Health has done, we know that about 95% of our restaurants and our businesses are compliant. But it's the 5% that we have to worry about as well that are not compliant, that can increase the spread of this virus in our community. So the advisory is clear. We are encouraging residents to perform only essential functions, which would include going to work and school, going to get food, whether it's from a grocery store or a restaurant, going to medical appointments, or seeking health care as needed.
And this is Joe Mazzola. I think, again, I would agree completely with Dr. Roberts. I think what we're trying to do is strike a balance here and make sure that, again, that we're giving our residents the information that they need to make better choices as they go about their everyday life. And so whether that's deciding whether or not to go out to eat, or how they can go about their day with respect to other essential services, we want to make sure we're providing that information to best do that in the most, in the safest manner. So, we're looking forward to continuing to implement this guidance and share it with our residents. And we will be continuing to reach out to our food service operators and other businesses to ensure that they can operate as safely as possible.
I think Carrie Ghost has a follow-up. Carrie?
My apologies, I forgot to hit my hand.
No worries. Pete, do you have a follow-up?
Oh, I didn't mean to click the button either.
No worries. Are there any other questions from the press at this point?
Mr. Mayor, you mind if I actually pose a question to Commissioner Mysheika Roberts? I just got a text from a friend who runs a funeral business, and I just wanted to, I think somebody hit on it earlier, funeral and churches. Commissioner, could you hit on our advisor and how it talks to funerals and churches or in weddings?
Sure. Thank you for that question, Council President Harden. So the state order for mass gatherings does exempt weddings and funerals from the 10 people or less. Our advisory is discouraging those activities. Again, it's advising them not to occur or to find safer ways to occur, i.e. remotely.
Thank you.
You're welcome.
Any other questions from the press? Any closing comments from Dr. Roberts, Commissioner Mazzola, any of the county commissioners, Council President? If not, appreciate everyone joining us here today. If there are future questions from the press, please feel free to follow up with the Communications Office in the Mayor's Office, Council, or at the County Commissioners, and we'll get you answers to your questions. Thanks for everybody's time this morning. Stay safe.
Wear your mask.